University of Toledo Medical Center, and we're joined today by Dr. Kristi Skeel Williams of the Psychiatry Department here at the university. We thank you very much for your time. And we're talking today about seasonal affective disorder. So, Doctor, tell us a little bit about what that is.
Seasonal affective disorder is very similar to major depression. In fact, it is a kind of major depression. The main difference is it occurs in the fall and winter. So it comes on when the days start getting shorter, and then it goes away in the springtime. The other big characteristics of it are that people crave foods, especially carbohydrates and sweets. And then they also just want to sleep all the time. So they want to sleep a lot more than they would during the summertime.
Okay, and so we're getting into that season now, so we'll be seeing more of it. What are some of the things, aside from the eating and the sleeping, are there anything else that people should watch out for that they might be getting affected by this?
They feel very fatigued, and they may have low energy levels, not be interested in doing the kinds of things they would normally enjoy. And those are some of the major symptoms. Problems concentrating at work, maybe not wanting to spend as much time with their friends and family.
Okay, so if that happens to somebody in my family or somebody who I know, what are the next steps? What do I do to try to correct that?
Probably the first thing is to go in and see your primary care doctor, and they may be able to steer you in the right direction or recommend treatment options for it.
Okay, is this something that needs medication? Is it a therapy kind of thing, or where do you go?
Interestingly, the first-line treatment for seasonal affective disorder compared to major depression is something called a light box. So they actually have boxes with very bright lights. It's much brighter, 100 times brighter than normal light is. And so you sit in front of that light box for about 30 minutes in the morning, and that is the first-line treatment for it.
Really?
Although some people actually like to take antidepressants just as someone would with another depression.
Yeah. That seems like a very simplistic fix, especially with the days getting shorter. Is this a rare thing? Is this something you're starting to see an increase of? Where do we stand in the numbers?
Well, in North America, it's about 3% of the population, up to 3% of the population that's affected. The other interesting thing about seasonal affective disorder is it occurs more commonly the further away from the equator one is. So the farther north you live, the more likely you are to get this disorder.
Okay, so we're obviously more apt to it than Central America, Mexico, or even down to Texas.
Right.
Florida. Okay. All right.
And Canada is more commonly associated with seasonal affective disorder than we are.
They should start getting further north up there.
Right.
So is this young people you see it in, older people? What's the age range?
It can be either. It's more common in adults than in children, and it's twice as common in women as it is in men.
Okay. So basically, we want to keep an eye on it, especially as we're starting to get into the fall and we're wrapping up with summer. I guess it's got to be a touchy issue when you bring it up to somebody that you're noticing their mood change. But from your experiences, is that tough conversation something you have to have with somebody?
It's important to have that conversation because people may suffer with these symptoms. They don't want to feel depressed. They don't want to have symptoms of feeling tired all the time, eating, gaining weight. And so going in, talking to a primary care physician, they can certainly see a psychiatrist or psychologist as well. But it does help to get treatment for it. And there is treatment, and the light box works for 4 out of 5 people.
Wow, okay.
So there are very effective treatments for it.
All right, good and timely information. Dr. Kristi Skeel Williams, we appreciate your time. And that is your Talk Back.